On behalf of the expert group for 8 studies, I'd like to wish you a warm welcome to this launch of this report, applying a men and masculinities lens to the gendered impacts of social safety nets. And we're very glad that Promundo had the possibility to write this report for the expert group for 8 studies. My name is Julia Schalk, and I'm one of the expert members of the group. For those who don't actually know EBA, EBA is a government committee with a mandate to evaluate and analyze Swedish international development assistance. So it's quite a broad mandate that we have. We do sort of what's called traditional evaluations of development cooperation, looking at thematics or country level collaborations. But we also do quite a lot of more reports that improves the knowledge of the context that development assistance, development cooperation takes place, which is more of understanding the challenges of not only sort of how development assistance is provided and the results of it, but also understanding the different contexts that it is provided within. Today we are launching a report which is part of a priority that we've set, where we've said we want to focus more on sexual and reproductive health and rights and health broadly, because this is an area that the Swedish government has made as a priority. And we started this discussion on masculinity and what does that mean for gender equality, and initiated this dialogue with Promundo, who is one of the leading actors, or perhaps even the leading actor within this field. And also through that dialogue, brought up social protection system as an interesting entry point for that, which we will hear more later. I'm really glad that there are many different participants. Looking at the participant list here, one of the things that EBA I think is very important is actually to bridge the gap between research and practitioners and policy, so-called, and we do that in different ways. We obviously have launch of reports like this, and seminars. We also have what we call development dissertation briefs, where we ask new PhDs to present their findings, and I think that's an excellent way of inviting research and new research to reach policy and practitioners. I'd also encourage you to listen to our pod. We just released a theme on discrimination and how to work with anti-discrimination from a civil society perspective, and many other topics that are very interested if you're interested in development cooperation. Also, other things that we look forward to within this priority field that we have. We've just started, and I'm very glad that we started a collaboration with Word Value Society. Thank you. We have a group of them here, and Karolinska Word Value Survey, where we look at social norms and SRHR. So that is a huge project and very important. Also, a report is coming up on sextortion with Åsa Eldén and Elin Bjarnegård as writers, and we've also launched just a report on this that I talked about how to work with anti-discrimination. So a lot of issues coming up and already been released. The program for today is that we'll hear different presentations on both the current research on social protection systems in low and middle income countries. That will be presented by Lisa Hjelm, who is the program manager at EBA Secretariat, because unfortunately Miguel Niño-Zarazúa, who was supposed to present it, unfortunately had to cancel it in the last minute. But we're very grateful for Lisa, who's been brave enough to speak in his behalf and with his presentation. So that will give us an overview of what we're talking about when we're talking about social protection systems. And then we will hear about, from Sida's perspective, how Sweden worked to support social protection, and we were glad to welcome Ulrika Lång to do that. And then I'm glad to invite Promundo afterwards to actually present the reports and then finding how masculinities and a gender lens would fit into this context. And after that, we also will invite two more persons for a panel discussion, Gunnel Axelsson, Nycander, from ACT, the Swedish Church. And very glad also to invite Serajuddin Joya, is there, from the Swedish Committee of Afghanistan, who we saw were in Sweden, and we just jumped on it and took the opportunity to also invite him to this panel to use that experience that he has from Afghanistan, working with men and masculinities in that context. So we have a full program. I will, however, try to invite you, the audience, as much as possible. So there will be opportunities to, after each presentation, ask questions for clarification. And also in the panel, of course, you're more than welcome to also join the discussion with your input or question. But without further ado, we will start, as I said, with Lisa Hjelm, who will guide us through the development and impacts of social protection systems in low and middle income countries, based on the presentation of Miguel Niño-Zarazúa from UNU-WIDER.
Thank you, Julia, for that introduction. And I hope I will make this presentation justice.
That's fine.
While Miguel is having fun leading a workshop in Namibia that had to change dates, I hope I can present this in a good way, but maybe a bit briefer. But really the purpose of this presentation is to give you an overview of what is it that we mean when we talk about social protection system, and how have they developed, and what is the status at the moment when we talk about social protection. First, I just want to mention that social protection, it is both a human right and is also seen as a way to reach the SDGs, and especially the SDG number 1, which is to end poverty in all its forms everywhere. And it's even included as a target in the SDG number 1. So it has really become an important aspect on the policy agenda to reduce poverty. And this reflects that there has been a shift in the policy thinking, now thinking that social protection, together with other aspects, has to be part of reducing poverty globally. And when we talk about social protection, we often divide them into different categories to make it a bit easier to think about it, even though often they are part of a bigger complex system. But to make it easier, they can be divided into 3 different groups of programs, where the first one is social insurance, where participants have to contribute to the program. They have to pay an insurance benefit to get part of this program. And that could be, for example, health insurance or unemployment insurance. Second group is a set of more policy-oriented programs that are labor market regulations, such as minimum employment standards and workers' rights. And then the last one is really what we will focus on today, and that is social assistance or social safety nets that are, for example, unconditional cash transfers, conditional cash transfers. It can be public works programs, and really the characteristics of these programs is that they are non-contributory. So this is what throughout this seminar we will have the main focus on, even if there might be different discussions as well. So even when we talk about social assistance, they can also be grouped into different categories. And looking to the left in this picture, there are the pure income transfers, or what we could also call unconditional cash transfers. And that means that this benefit will be distributed to households or families based on one or more characteristics of this household. A common one is, for example, that there is a child under a certain age in the household or the family, which I'm sure in Sweden you recognize. This is very similar to the Swedish child grant barnbidraget. But there can be other types of household characteristics, such as poverty levels or disability or old age. Then on the other side in this diagram, there are the income transfers plus social services, going towards a bit more integrated programs. So one big and common program there is the Human Development Programs, often also called the conditional cash transfer programs, focusing on one social issue in the society or several social issues in the society. For example, low school attendance. So the idea there is that this grant will be, or this benefit will be provided based on the household fulfilling a conditionality or several conditionalities, which can be that all children are attending school, or that children are getting a certain number of health visits or vaccinations. Another type there is work-for-fair programs, which is also included in the analysis that we'll hear about later. That is, common one is public works, where people that are living in often poor settings are offered a low-paid income based on that they're doing jobs that are often also aiming at creating assets in the community. So these can be infrastructure projects, creating roads, for example. But now, as more and more countries are going towards integrating different types of programs and creating social protection systems, many of these programs are complex and using different parts and different types of social assistance in one program and going towards more integrated programs. And not included in this picture, but which I think is worth mentioning as well, that many countries are now also experimenting with how can we provide a cash transfer, but at the same time provide other social services, creating linkages between cash transfers and other sectors, for example, the health sector. So focusing on those in the society that needs these programs, which are often the poorest and most vulnerable households, thinking that they probably also need other social services. And maybe that services are there already, but they don't know how to access them, they don't have the information. So making the linkages between these types of programs is a sort of, I don't know if it's a new approach, but many countries are working on that as well. This diagram gives a view of how social assistance programs have increased over the last couple of decades. And I should say that these are the numbers of programs divided by the different types. But at the same time, the coverage of these programs have also increased. So if we would look at total number of beneficiaries, this would probably be an even steeper curve. And also worth mentioning, even though this looks like it's going in the right direction, we'll see later that in some areas coverage are still is still very low, and a lot has to be done to really meet the targets, even the targets of the SDGs. So this points towards new thinking that to fight poverty, there has to be comprehensive measure to reach these goals. And social protection and social assistance in this case, really the benefits of these programs are that they are building systems. They are nationally owned, often tax financed. And as we'll hear in the next presentations, donors have had an important role in this and still have. But the most important thing is that they're contributing to building national systems, and these programs are being included in the existing institutions. And that is also why it's interesting to see how we can think about gender issues in these dimensions. And yeah, it's an important policy instrument, and currently more than 860 million people are benefiting. So it's large. It could be even larger though. This is showing a little bit about the coverage at the regional levels. So how this table is organized is that it's by region and by quintile. So to the left here, you see the poorest 20% in these regions. So what's interesting, especially about this one, is that you can see here in sub-Saharan Africa, among the poorest 20%, there is still only 12% in this whole group that are covered by social assistance and social insurance. And another interesting aspect of this is that these programs and policies are sometimes pro-poor, but not always. Sometimes it's across all sort of wealth quintiles. So in certain regions, there is still a long way to go to reach coverage for all. This is also showing the coverage. However, here it's divided by the different types of programs. And what's interesting with this picture is to see how social assistance has developed differently across different regions. So for example, in South Asia, in-kind transfers is an important type of program, while in Latin America and the Caribbean, the conditional cash transfer programs have been one of the more important programs. And even though sub-Saharan Africa, it's still generally low, but the focus has been more on first in-kind transfers, but then also the unconditional pure cash transfer programs. But as I said earlier, also programs are, and countries are mixing different types into the same systems, also like we do here in Sweden and many other countries. So it's also a bit difficult to strictly divide like this, but this at least gives a little bit of a picture of what it looks like over the different regions. So what do we know about the impacts of these programs? Do they actually work? And we have, or first I should actually say that before starting to say these are the general impacts, keep in mind that it's a bit difficult to say something about what are the effects of, for example, a public works program in one country or even a region or continent, and a child grant program in another country and region. So it's hard to say something very general, and most reviews that have been done have not focused on social assistance as a group, but rather looked more specifically at cash transfer programs. And for example, the review study by Bastagli, they have extracted evidence from 56 different cash transfer programs and even more studies studying these cash transfer programs. And some examples, what they have found are reduced monetary poverty, raise in school attendance, they have stimulated health service use and improved dietary diversity, they have helped foster beneficiaries' economic autonomy, they are also associated with a reduction in child labor and increase women's decision-making and power and choices. But I think this part about the gender effects we'll hear a lot about later today as well, so I don't want to say too much about that. And the other important point in this slide is that, of course, even though we see those impacts generally, the design features of the programs, for example, the transfer size will be very important and depend on what effect we see. The access to complementary public services, what do the public service infrastructure look like in the country, and social norms and structural factors as well. So, as some concluding remarks, social assistance has been growing, but there are some important variation across the regions. There are still a lot of challenges ahead, and some of those challenges are not small challenges. They include, for example, domestic politics, political economic considerations, financing and institutional capacity, and in addition to these, a number of operational challenges. Just the fact of getting a little bit of money out to millions of beneficiaries every month in a timely manner, that is not a small thing. But many countries have succeeded, so I think we can be optimistic that this is still growing and expanding. And of course, as I said, there is now evidence that these programs are effective. But to really make a difference, there is a need of a mix of social policy programs, including social assistance, social safety nets, but also education, health, sanitation, and so on, with a good tax policy in the country to make sure there is a longer-term sustainability of these programs in the countries. And that was all. I hope you got a good, brief overview.
I have to say that was extremely impressive to do another person's presentation with such a short notice in that manner. I'd like, before we open up for questions, to invite first Sida again and Ulrika. Ulrika Lång is a policy advisor on social protection. That's why you're here. But you're also acting head of the unit Justice and Peace at the Africa Department and been working at Sida since 2000. But before that, also worked with the Foreign Ministry and Olof Palme Center. So you have a very broad experience of development cooperation. But I welcome you up here now, so for all of us to learn a little bit more on Sida's support to social protection system. Welcome.
Thank you. I will give a brief overview of how Sida views social protection and how we work with it. And Sida shares the definition that the international development community has of social protection as a set of policies and programs aimed at preventing and protecting all people against poverty, vulnerability, and social exclusion throughout their life cycle, and to placing a particular emphasis on vulnerable groups. And the focus of Sida's support to social protection is, we have 5 key focus areas, but although we work quite broadly, but institutional development is a key priority. We want to support capacity development so that countries can lead their own development of social protection systems, because social protection system really requires a long-term engagement of the state. Gender equality is another focus area, and to capture the synergies with humanitarian aid in many contexts that we work. There are ongoing humanitarian crises that can last for a very long time, like refugee situations that last for decades. And in other countries, we have a situation where there are reoccurring humanitarian crises. For example, droughts that come every year, every other year, causing humanitarian situations. And we also prioritize to capture the synergies with health, nutrition, education, and other areas that are important for poverty reduction. And then finally, domestic financing and resource mobilization is a key issue. Lisa already gave you an overview of the social protection, how wide it is. We have this picture at Sida which shows, how you see social protection includes everything from social safety nets with cash transfers, public works, to social care, child protection, family services, to social insurances which are contributory, such as old age pensions or unemployment insurance. And then finally, policy and legislation, which can be legislation that you can have sick leave and that you cannot be fired if you are ill, for instance. And you see, Sida, we work in this orange square, mainly here, with Cash Plus. And Cash Plus is sort of what Lisa also described as integrated programs. That is regular cash transfers, but with additional components or linkages to other programs and sectors. And that can be expansions of public services or improved quality of services, often the linkages to education and health. But it can also be training or communication to change attitudes, behavior change communication, for example, on gender equality or knowledge about nutrition. One example of that is a new program that we have in Burkina Faso, where we see that stunting of children is a key challenge. It's a key challenge in all over Africa. Over a third of all children are stunted, which means their growth is inhibited, and also their development is inhibited because they don't get enough nutrition during their first years, which will affect their whole life. So this is a key issue which we also try to work with. But in Burkina Faso, then we have, in this pilot project we expand water and health services in the communities, but we also have targeted health care and antenatal care to women who are pregnant, and then to the children during the first 2 years. And then we have behavior change communication. And the behavior change communication is linking to nutrition, which is a key issue, but it's also linking to good parenting, because there's a lot of violence against children. And also we see a key issue which we hope to have some effect on, is that over half of all girls in Burkina Faso are married off before they're 18 years, and 10% are married off before 15 years. So we hope that the behavior change communication on good parenting will improve that situation. And our support to social protection is largely bilateral support. We are now supporting programs and projects in 13 countries, one country in Asia, Cambodia, and 12 countries in Africa. And it's been an expansion over the last 5 years, quite a rapid expansion, and we expect to expand more to even more countries, because we see it as a very effective way to reduce poverty, but also a human right. And we have global support to the Transfer Project, which is a research project that has undertaken research on social protection and the impact of social cash transfers. Particular emphasis in Africa, but also in other countries. And the Transfer Project is led by the UNICEF Office of Research in UNU-WIDER in cooperation with the Food and Agriculture Organization, FAO, and the University of North Carolina, Chapel Hill. And they have done extensive research on different aspects of social cash transfers. We also have an international training program in cooperation with the Swedish Employment Agency who's here, and a few other Swedish agencies, and also with the South African Institute, EPRI, who is specialized in training and research on social protection. And then we support a global program with the World Bank, the Rapid Social Response. And if we look at gender and social protection, the conclusions that we see from some meta-studies that have been undertaken, for example, by ODI, but also from transfer project research, some of the conclusions that we have seen is that it often contributes to increased productivity for women, increased savings and increased entrepreneurships. It contributes to increased well-being, emotional and mentally. Happiness, as one study said, and one particular aspect of happiness was not having to worry that the children did not have sufficient food. Less worry about that, which of course is an important part of well-being. One very interesting result that we have seen recently is that in a majority of cases, cash transfer programs can contribute to decrease gender-based violence. And that is without doing anything, actually. Just with the cash transfers contributes to decrease gender-based violence, and many times more effectively than projects that are directly targeting to decrease gender-based violence. And why this is, there is still ongoing research on that is not explained, but the hypothesis is that the stress of being extremely poor causes violence, and reducing that stress can reduce violence. Because some studies that have looked at attitudes have seen that actually the attitudes to gender-based violence didn't shift, but just the actual violence decreased. And we see that cash transfer programs have contributed to increased opportunities, particularly education and employment, but that is for both women and men. But we also see there's a risk of an increased work burden for women when there is conditional projects. And for Sida, we see that integration of gender equality is important to enhance the positive effects. We can achieve even better results. But we need to have a context-specific analysis as a starting point, because what are the most important issues for gender equality in each context? We need to know that, and then to see how do we address this in the social protection program. And then we see the value of linking social protection to other sectors, Cash Plus, and to engage both women and men. And we see a key issue is also to have clear manuals on gender equality and to have staff that is gender aware. So our work on gender and social protection, we have increased it in the last couple of years. We have raised it in international coordination to strengthen it, in the EU and EFTA coordination on social protection, in the International Social Protection Interagency Board, which also has a gender working group, and also in the UN meetings that have been lately, the Commission on the Status of Women, where social protection was a key issue, and where we, Sida, had a side event together with UN Women, and also in the Commission on Social Development. And we work with internal methods development and training. We developed this brief on gender integration, which you can find outside. It's a very brief, and it also has a lot of recommendations of further reading on gender in social protection. And we continue to support research because we think that the knowledge is very important for for developing how we work with social protection and how we work with gender. And then I would just give a few examples of our programs and what we support to make it more concrete. The PSSM, Productive Social Safety Nets in Tanzania, it combines education, health, nutrition, public work, livelihoods, and cash transfers. It reaches 5.5 million people. And it has one part that is a basic cash transfer that targeted people get. And then it has one part that is conditional. So if children are sent to school, attend school, then there's additional cash transfer. And if children under 5 years are taken to the health clinic for checkups, then there's an additional cash transfer for that. And for Sida's part, we know that conditionality is not actually useful. It takes a lot of time, it takes a lot of staff efforts, there are risks of errors, but we see politically in Tanzania, this is important. So then, and the political, the governance has to be part of these programs if we are going to build social protection systems in the long term. So we support this. We also have communication linked to nutrition and livelihoods. The results we have seen is increased food security, increased school attendance, increased literacy, increased livestock ownership for families, and we see for gender, we have seen increased well-being, increased autonomy, self-assessed wealth, and household decision-making is improved for women. But we see no change in intimate partner violence or sex habits in Tanzania, which we see in other countries. So then why don't we see it? Well, that is something that we continue to evaluate and do research on, because each context differs. So why we have positive results, that was a bit discouraging. But still, the school attendance and literacy may be some of the most important things we can do for empowerment of women and girls, I think, in the long term. The PSMP in Ethiopia, combines public works, education, health, nutrition, and livelihoods. It reaches 8 million people, and it has conditionality with public works, but elderly, disabled, pregnant, and lactating women are excluded from this. They receive support all year. And we have a communication component. Actually, what Sida we do not support the PSMP directly. We support a capacity development program via UNICEF that does pilots and that supports the government's development of capacity in social protection, and that also supports expansion of social workers. And we have trained barefoot social workers at the village level that follow up the links to health and education and nutrition and well-being. And I think that barefoot social workers are really also a very interesting potential to actually work with gender equality. And the results we have seen is improved food security, increased livestock ownership, productive investment, and actually a decreased need for humanitarian aid, that is one aspect. And the gender results we have seen, actually they have managed to adapt public works to gender, to the situation of women. We have an improved school enrollment for girls in particular, but the gender roles in the household are maintained. We haven't achieved, but it hasn't been directly addressed. And finally, I know my time is up, so I will not say much more, but I say in Uganda we're starting a new program which will work in the West Nile area, the northern area, which has received 800,000 refugees from South Sudan. And then we will have an in-depth gender analysis as part of the design phase. So those are just a few examples of how we work in different ways in different countries. Oh. Thank you.
So I'd like to see if before we continue, if there are any questions of clarification at this point. We will, of course, come back to the discussion, but if there's anything that you'd like to know more. Yeah, there's a... Here, sorry. Before we deal with the microphone, I also want to say if you feel that you missed anything or you have colleagues or friends that are eager to learn more about this subject, you will also find this whole seminar on YouTube later, and you'll find the link at the IBA website. So if you're also eager to show your face, no. Please, go ahead.
Okay, just a short question. I'm Jörgen Levin, Nordic Africa Institute. I was just curious how Sida is financing this social protection program, because you mentioned you're working, the ownership of the government is very important. So is this direct, some kind of budget support to the government, or it's kind of more project sector-based?
Good question. I should have said that. Actually, in a couple of countries we've had direct agreements with the government. That is Tanzania and Zambia. In other countries we work through other partners, and often we do actually projects or grant big projects and pilots, and we always have research and evaluation linked to them. Our main partner has been UNICEF at country level. We also have some cooperation with the World Food Programme and and some with the World Bank, but mainly UNICEF has been the main partner.
I think there was also a question. Please go ahead.
My name is Malena Lidholm. I work for the Santa Party International Foundation. My question is, maybe it's directed to you, but maybe even more to the first speaker. I was blown away by the difference in terms of continents or regions, that Africa was so extremely low. I mean, I knew it was used little, but these contrast really amazed me. So I'm very happy to see that all the examples you gave from Sida, that you are obviously aware of this, and that's why you're working in Sub-Saharan Africa on it. But do we have any kind of idea why it's so extremely low? I mean, I can think of some ideas myself, but why have you looked into that? Why is it so much lower for Sub-Saharan Africa and for other regions?
Lisa, do you feel okay of answering, or? So
I think that the one thing that I can say is that, as you saw also in this graph with the race of social protection, Sub-Saharan Africa started a bit later compared with other regions, so it has been steeper growth. So I believe that is part of the reason. It's still fairly new, and there are few countries that have actually reached national coverage. So starting from pilots, they're now starting to expand, but it has taken some time. I think that could be a good answer, or the best I can give, at least.
thank you. One more question. There.
Good morning. My name is Veronica Persanowska. I'm working as a gender advisor at the Africa Department at Sida. I just want to have a clarification in regard to the cash transfer. Who is the recipient? Is it the household, or is it the women or the men in the household?
It varies, actually. In many countries, it is women are prioritized, so women are often prioritized as beneficiaries, as the recipient of the cash transfer, and that itself is seen as an empowering aspect of social protection programs. So it's good that you bring that up. But in some countries, it has been the household, and then oftentimes it's also mixed, because if you look at the disabled or the elderly, I mean, there you have a lot of men also. So. So it's a mix, but it's more women as beneficiaries than men. And one aspect regarding why Africa is so far behind, I think it's because the governance in Africa is also much less developed than in Latin America or Asia, and the capacity of the state, and also the size of the economy, the tax base, and there are many aspects. I mean, you will see that health and education is also less developed in Africa. So it's an aspect of poverty and the context.
Thank you. Just quickly before we move on to hear the actual report, I just want to, you mentioned, for example, how you link it to behavioral change programs, for example. In that context, have you so far worked with masculinities and male engagement? As far?
We haven't worked with the masculinities per se. In Burkina Faso, we directly target. I know that both men and women will be involved in the behavior change group, but the focus of the groups will not be masculinities per se. It will be nutrition for children, good parenting, which is making that children go to school, that they don't hit children, and that we want to also affect that girls are not married off young. So that those I think are the main issues that have also been identified in the UNICEF country program, and which we think are key actually to empower women and girls and to improve the lives of women and girls in Burkina Faso. Okay. So that has been an entry point. And then, of course, it comes in to some extent, but not in that targeted way. In Uganda, it may come in if that results from the gender analysis, which will look both at women and men's situation.
We'll see what this report might inspire you to do in Uganda as well. So thank you so much, Ulrika. And with that, we're now come to the point where we are presenting the report, again with the title, Applying a Men and Masculinities Lens on Social Safety Nets. And here to present that report is Gary Barker. Unfortunately, his co-writer, Joanna Lauro, has become ill this morning, so we'll hear Gary present and take the panel discussion on his own, but of course we wish Joanna the best, and we miss her here. But Gary has a PhD in developmental psychology and is currently the president and CEO and founder of Promundo. And I was amazed to read you not that you have 20 years of experience, but that you've been living in 40 countries? No, Promundo Partners. I was like, wow, that's that makes so much more sense. I just thought sort of we have to have lunch after this just to hear how that is possible. Okay, that makes sense. So Promundo has partners in over 40 countries. But Gary is also the co-author of the report State of the World Fathers. That's been launched in 2015 and 2017. But now you're here to present this report on masculinity and social safety nets, and we very much look forward to that.
My immune system was feeling really strange to think that I lived in 40 countries, but anyway. Thanks, and I'm sorry, my colleague Giovanna, she sends her regrets. She's got a terrible back spasm, and we're trying to figure out how she will get home this evening. So you only get me. I think it's important to start off in asking this question about masculinities. It is not to say that somehow cash transfer programs or social safety nets that we want to decenter them in any way. I think it's important to note that the gender focus and the empowerment factors of engaging women as the beneficiaries for the majority of cash transfer programs and other social safety net programs is one of their success elements. So this is not about saying let's decenter, let's toss them out. Let's say how do we help them work better by applying a more thorough masculinities lens to them. I'll also start off saying my bias, but also kind of focus of most of our learnings on these programs comes from Latin America, which in some ways has been certainly the developing region of the world that implemented these at scale soonest, and currently about 1 in 5 individuals in Latin America benefits from a cash transfer program. So it does continue to be the region of the world where the programs, at least one version of them, has been the most universalized. So some of our reflections, at least where we have partnered, have been mostly in Latin America. Just a bit about Promundo. We've worked for 20 years with this approach of how do we engage men and boys as part of gender equality, doing that together with women and girls, and thinking, of course, about gender diversity, not just thinking about male and female identified nor heterosexual only individuals. About half of what we do is research. We started in the Global South and now have offices in Brazil, DRC, the US, and also an office in Europe. So before framing the study or before presenting the study, I think it's important just to say how do we understand what we mean by masculinities, and a few points that I think sometimes are obvious, but they're useful to start. One is to think about the contextual nature of men's behaviors and of masculinities. We often use that word masculinities as if there's some universal one sitting in the room, or as we talk about men's responses to any kind of program approach, as if there's some universal man. And we also often even take a masculinist approach to men's behaviors, as if we somehow got that individual man to behave well, that gender equality would be fixed. And I think it's important to say we do want to call individual men out at times and nudge individual men toward being part of gender equality, but to understand how men's lives are affected by social norms of those around them, what they see in the home, access to employment, migration patterns, and lots of structural factors. So this is not to let individual men off the hook, let's say, for behaving badly perhaps, but it is to say we live in context, and understanding men in that regard I think is really key. Also just the diversity of men's responses to gender equality. Promundo's carried out since 2008 a global survey, well, a 40-plus country survey called Images that Sida has been a partner with in some countries. That's the International Men and Gender Equality Survey. If there's some big headline that can be reduced in that large data set, it is that no matter where we look, there's probably a quarter to a half of men who, in theory, say they support gender equality and women's and girls' rights. The more we ask them about getting closer to home, are they willing to share power at the household level? Would they be willing to give up a job, a university position, a government position in the name of equality? Then we see the support begins to take a nosedive. And at the individual level, in terms of control of female partners, control of their daughters, there in many parts of the world we find a lot of lingering resistance to this global project of gender equality. But nonetheless, we see a lot of diversity. And so looking at any setting, it is important to say there's no single pattern of men's behaviors there. The other thing that we have to look at is no matter what other major changes we've seen in women's lives, and particularly around education and the slow but steady growth of women's participation in paid work, getting men to do more of the care work has been really sticky, slow, and sluggish. We don't have a lot of places in the world where we see men doing more of that. That seems a really sticky part, and I think that's where we can see what cash transfer programs can do. So what about this field? There's a field of practice around engaging men in mostly community-based interventions that's now 25 years old or so. A couple of colleagues here in the room have been running some of these in parts of the world, including here in Sweden. Most of these, when we say work with men and boys, we're referring to group education processes. There's a lot of activities that look like this, often short-term campaigns, and then a lot of training in the workplace, training of teachers, training of coaches, training of those who reach men. Most of this, and we've got good evaluation, it can work. And we can measure attitude and sometimes behavior changes reported by men, reported by their partners in multiple ways when we do this. There's a field of practice that those things can work. The ones that work the most, we typically call them gender transformative. That means they're doing something to try to change, not just will individual men use condoms, for example, but trying to change the norms that seem to drive, in many cases, men's behaviors about whether it's reproductive health or something else. And we use that language a lot to refer to programs that don't just say, let's invite a few men in the room and talk to them, but that really try to change the norms that drive, or at least one of the drivers of men's behaviors. The issue is that these approaches, as much as they work, we've done very little to take them to scale. And even the nature of them, of promoters and doing the training of trainers and the like to scale up, is limited in terms of the number of people we can reach. There's a few institutional approaches, and by that I mean efforts to engage changes in men and masculinities in some big, large-scale sectors. There's a few examples in the health sector, by engaging, for example, the prenatal visit as a place to engage men and training health sector workers on how he can be engaged if he comes in to the space or if he drops his partner off. Things that can be done to take advantage of the fact that in some countries, 80% of men are coming for at least one prenatal visit together with their partner. Educational approaches where we build it into teacher training, for example, or school-wide approaches. A few workplace examples of taking across whole sectors or whole workplaces and including specific messages around healthy masculinities. And policy changes, things like parental leave and the nudges that the Nordic countries have done around getting men to take more paternity leave, for example. But this big set of programming around poverty alleviation and all the, whether we're calling them social protection or social safety nets or cash transfers, there's been very little work to deliberately engage men in positive ways, or to take into account masculinities in designing the program to see if we get better benefits, both around poverty alleviation and around gender equality. So we were thrilled when colleagues from EBA said, we're interested in looking at some larger scale approaches. What does Promundo think would be an interesting area to look at? And again, from the Latin American perspective, and from our perspective of working in Brazil, where the Bolsa Familia program has been in existence for now close to 20 years, and reaches 15 to 18% of the population, we said, this is something that needs to be troubled and looked at and understood, because here's a tremendous advantage to influence gender dynamics by also possibly engaging men and boys and masculinities. So we were thrilled to be invited to partner. Just want to start off with the time use issue because I think that is not my time for the presentation, but how am I doing, by the way? I'm okay? All right. But the global time burden on women, and I think that's, as we look at the biggest challenge perhaps to women's full use of the benefits of social protection programs, it's the time poverty issue for women. Globally, we know the global average of women's time use in unpaid care work compared to men's is 3.3. That's the global thing that women do, 3.3 times the amount of daily care of homes and others compared to men. That ranges from 10 times in places like Cambodia, that is women doing 10 times the amount of daily unpaid care work, to 1.25 times here in Sweden. So Sweden and Iceland, you're close to the global champions on this, but no country in the world has achieved equality on men and women doing unpaid care work. If we look at the paid work plus the unpaid work and leisure time and all the rest, women do on average 30 minutes to an hour more every day if we take one global average. If you do the math, that's about 2 weeks free vacation leisure time that men get compared to women. That could be 2 weeks of Netflix binging, whatever you happen to do with the time, but that men have compared to women around the world. Obviously, big differences, and that doesn't mean all men don't do their part. But I think it is important to say this is probably the stickiest point in terms of women entering paid work and also having the full access to the benefits that social protection programs and the add-on programs that come with them offer, including access to education, job training, and work itself. So the research question that we took was, what do men and masculinities have to do with social safety net programs that aim to promote women's economic empowerment? Can you find in the existing literature examples of how men respond, or if there have been any deliberate efforts to engage men in positive ways in these programs? We did key informant interviews with some of the voices in the field who have been working on these programs for many years, and then a literature review as well. We included in the review conditional and unconditional cash transfers, in-kind aid, vouchers, public works programs. There's a long report. I won't go into all of those. I'm just going to try to do the headlines. I think we saw in the previous two presentations that there's some evidence of positive gender-related outcomes, women's increased participation in education, health benefits, the impact around gender-based violence that we've seen. Those things seem to hold. Obviously, big differences across country context, but also urban and rural, parts of countries based on work patterns and migration patterns. Lots of stuff factor into those, but in general, there's a lot of very positive ones. On the other hand, there's a lot of issues that suggest the overall logic of funds going to mothers can also, in many parts of the world we can see, be a damping factor on her going to seek additional employment or paid work. We've seen this in our work in Brazil, where some qualitative research that we did with the Bolsa Familia program found that in households where men were present, often he took the logic that, well, honey, querida, you're now getting paid. You've got some income, so why don't you stay home and care for the children? I'll do work. We've seen in Colombia as well with Familias en Acción that at the rural area, recipients compared to non-recipient families, women tend to work less when the family receives, that is, work outside the home. Now, feminist economists for a long time have said we need to find a way to pay for care work. So in one way, this is positive that care work is being paid for, but that's not doing much to change the gender divide. It is a poverty alleviator on the one hand. It does support what families need to survive, but it's not changing the gender binary that men tend to do more of the paid work and women are doing a lot more of the unpaid work. So our biggest headline in looking is that while there's a lot of good intentions around gender in many of the programs, and the fact that women are the recipients, and in Latin America the number is even higher than what Ulrika referred to as a majority, it's closer to 85 to 90% of the beneficiaries of cash transfer programs specifically are women, with the logic that, not in Latin America? Yeah, no, sorry, in Latin America. Sorry, I meant to finish that sentence with Latin America, yeah. With the good historical reason that more money, women tend to spend more of that money in the household, although some new research is suggesting that that's not always the case and depends on where we look at it. That in some cases, in fact, men are spending as much or as much benefits make it to the household if the money is in his hands. So the logic is solid, but we're beginning to look more context by context to understand the impact of it. So the issue is that we saw pretty limited evidence that the programs take this fuller gender transformative lens in terms of believing that we could also engage men as allies in the process and change household dynamics in more profound ways in terms of gender equality. A telling indicator, and maybe one of the headlines, is there was a 2013 review by Chopra that looked at 149 social protection policies. None aimed to redistribute care work from women to men. In our updated review, we found a whopping 3. That is a start out of more than 100 plus programs looked at, plus that overlap some with the 149 that Chopra looked at. The interesting thing is, and again may be obvious, of those 3 programs that did anything to try to get men involved in positive ways, particularly around care work, there's evidence that men did do more hands-on care work of some kind. And partly to think about it this way, in most of the settings, men are doing really little care work. So a nudge can go a long way in a big sample size. So this is not that we have, gender equitable households necessarily, but this is to say some nudges actually get men moving the right direction, particularly if it's not this man doing it by himself. Particularly if you see other men around you in the same setting, and there's a kind of a more collective movement of this is normal behavior for men. We see kind of a ripple effect around social norms. But again, that's more kind of supposition and look at the study rather than that there's exact data on those points. So where do we see, in looking across these studies, kind of potential pathways for engaging men? And again, these are lightly mentioned in a number of these studies. We don't have a long table there that says we have indicators across all of those. Certainly men doing more of the care work we think is probably number 1. More equitable household decision making. What are ways that we can nudge rather than simply assuming that a shift of some income in women's hands automatically leads to that more equitable household decision making. In fact, we see the diversity of men's responses around the world. There's some evidence in income generation programs or microcredit programs that some more money in women's hands can in the short run lead to an increase in violence. Typically what we see overall is longer term, it leads to a decrease in violence against women at the household level. Couple conflict, another place related to that, of course. Men's roles in whether women are able to, through such programs, have access to the bigger world. That is one of the goals in a lot of social protection programs, is that women have access to other things, education, job training, discussion groups with other women on either household economy issues or also access to other forms of income generation. We don't look very often at how men react to that, and particularly men's attitudes in much of the world that they have the right to know where their female partner is. And so the need to think about how we engage men to change that. And related to that, whether men support, believe in, think that a woman's time outside the home working is as important as his. So we see a lot of need to focus more on kind of how men respond to women being in the paid workforce and men's contribution to paid work. I think it's also important to say, try to wrap up a bit here quickly, that most of the discussions of engaging men have typically been sort of at the margins, not necessarily do we make this a core part of the programs. And I think Lisa was saying, the administrative challenge that it is to roll out programs that involve, so in Brazil, the Bolsa Familia program is 10 to 11 million households, mostly more than 95% of those are women, receiving money every month on a debit card. Just the administrative rollout of that is massive. As you talk to the managers of these programs in Brasilia, or we've just been in meetings with Familias en Acción in Colombia, they basically say, don't mess with what's working. Don't consider that we're going to want to change this unless you can offer us really strong proof that this minor change will lead to a benefit because it is working. It wins them votes. Governments get reelected based on such programs. So yeah, there's a lot of status quo to say, let's not mess with the things of this that work. So I think this is what we've got to think about. To do any changes to the programs based on their scale is resource intensive, and I think we've got to figure out how we begin to test. So a few conclusions. I think most of those I've kind of said, but we do think it is worth troubling looking at engaging more with programs to figure out how men could be involved in positive ways more, include better indicators, asking more at setup moments around how men are participating, looking at ways that that complementary programming to engage men can happen. We think the gendered attitudes of those who roll out the programs also have to be looked at. Often some subtle things can make a huge difference of how cues that we have in posters or messaging around whether we think men will participate or whether we think men are kind of derelict and don't really care much about what happens at the household. We think there's more chance of connecting these with integrated social protection programs than changing necessarily in wholesale ways the cash transfer programs. So again, we think there's a need to do more of this testing of gender transformative complementary programming. Our overall headline would be, yeah, there's a lot of evidence that cash transfer programs work. They could be better, we believe, if we bring this masculinities lens. We're doing a little bit of work, and I've mentioned these two programs the most in Colombia with Familias en Acción, having discussions with the managerial staff to say, what are some ways that we could look at and begin to test, maybe in a couple of sites, engaging men, either father involvement in prenatal visits or child health visits, fatherhood workshops. They have a youth component as well that could be an interesting point of entry around healthy masculinity promotion, for example. Brazil's Bolsa Familia is now rolling out a home visitation program for families that have children under the age of 3. There's basically 9 visits between birth and when the child turns 3. It's about 40,000 home visitors. We're looking at working with them to train them on ways they can engage the father when they do those home visits and looking at testing in the state of Ceará. So again, looking at ways that where it feels to be solidly working, we could tweak, test, begin to look at an idea of how men could be engaged. And then I'll highlight that Promundo launched just a few months ago, together with partners, the State of the World's Fathers 2019, where we make the case for seeing men's caregiving within this ecological model. We need better policies and laws. We need to look at ways that we transform gender norms. Number 3, building the economic and physical security of families, including using and building on poverty alleviation and cash transfer programs. Finding ways that we support couples to do this in better collaboration and less violence, and the final part of giving men a nudge. And our 50-50, I meant to go back there. Our 50-50 commitment coming out of the report means we want to see countries have a goal that men actually do 50% of the unpaid care work. That sounds lofty and maybe utopic, but we think we need to say it. No country has a goal at the moment that it believes we could achieve that. And then the 50 minutes is, if we got men in the middle income part of the world anyway, to do 50 minutes more of care work, and women did 50 minutes less, we would have a huge motor toward equality at home. So we think maybe some cash transfer programs could take that vision, or at least hold it in mind of something we could try to work toward. Thanks very much.
Thank you so much. I'm wondering if there already now are some questions that you'd like to ask Gary. We have one here to start with, and one over there.
Hi, my name is Louise Lorenson. I'm a PhD student at Stockholm University, and I have a question. You mentioned the findings that the cash transfer might lead to a reduction in the labor income of the woman. And is that a general finding, or only for cash transfer that has like a means tested, like a condition on having a low household income?
Yeah,
Thanks.
I was referring to the data from, use this one. I was referring to the data from Latin America in particular on those, and that is for where the beneficiary is, or where the conditionality is living below the poverty line. And again, differences by urban, rural, by age sometimes, whether there's a child or not, whether the house, well, you have to have a child to get the benefit. So that is seen, but I think, we want to be careful that we contextualize it as well.
There was one question here,
yes.
Please.
Thank you, Gary, for a very interesting presentation. My name is Mariano Salazar. I work at Karolinska Institute. I was wondering about, I don't know if you have found this with your studies, but usually when men move towards a more progressive masculinity, more pro-gender equity masculinity, they may be facing a lot of backlash from their environment, from their peers who are actually, trying to push more traditional forms of masculinity that are gender unequal. And I think engaging with this program could be a good opportunity also to to create support networks for men who, for example, decide to stay at home and to take like 50% of the care of the children. Because I'm thinking that in Latin America, and I'm from Nicaragua, you may experience a lot of backlash. So you have a risk that those men who have changed, they experience a lot of pressure from the environment to actually revert back to a previous unequal behavior. So is there anything considered with this, or what has been your experience? Is this something that happened with men, and if so, how can it be? How can we support those men that have a more pro equity stance? Thank you.
Yeah, I think that an excellent point around whether we think the change is, with individual men or is it collective, and that we've done some testing with some village savings and loan groups in Rwanda and also in Burundi, and found that when the change was collective, that is, you had groups of men doing it, it seemed to be more lasting and less performance than if it was individual men and scattered in different villages. So yeah, there's very important. We know that as men, our behavior is often judged by other men around us, by women as well. And so changing these norms is not only nudging men to do the change collectively, but also we need women doing this. We see in some parts of the world that women will say, he doesn't know how to do that. Or in some parts of the world, it is even considered shameful that men do hands-on care work. It is so deeply considered her work. So yeah, I think it's clear to us, and that's why cash transfer or social safety net programs that reach such large proportions of households, if we get men doing this change collectively, I think it's much more likely to stick. I'm sure the Swedes, as Swedes, you could talk about what does it take when you see enough men pushing prams on the street, or fathers by themselves at, the latte father effect. What it takes to get enough men doing this, that this feels like normal. And I think we see clusters of, in say, urban Latin America, parts of Buenos Aires and Rio and Sao Paulo, you begin to see this as normal behavior of men carrying babies, and sometimes men by themselves. And men showing up to get the immunization visit, for example. But yeah, I think we've got to figure out what tipping points look like, that this is groups of men that see this is normal stuff, not just one of us that then gets critiqued by our father, grandfather, father-in-law, who says real men don't do those things. Yeah, really good point.
I see two more questions. I have one here, Eva, and then Sarah over there.
I'm Eva Jacobson, and I work at RFSU, the Swedish Association for Sexuality Education. And thank you for a very inspiring presentation. I worked quite some in Latin America and recognize many of your examples. I was thinking if you have seen any linkages between some social protection programs and fertility rates. In Bolivia, you have the Bono Juana Azurduy, which is a cash transfer for pregnant women. So they will do, in order to decrease maternal mortality and infant mortality, so they will do their prenatal checkups and also for decreasing infant mortality. But I've noted there have been some critique against this and maybe other similar programs, because they can actually increase fertility rates as a driver for having more children that you should have otherwise. Have you seen anything of that?
Yeah, I may look at Lisa and Ulrika around the fertility impact. You have to have any...
No, that's not true, actually. That's one of the common myths about cash transfers, that they would increase fertility. So it's been quite thoroughly researched, and there's no evidence that fertility is affected by cash.
In Mexico, sorry, you want to comment on that?
Wonderful. Please go ahead.
I think Göran Holmqvist, whom is an authority in this, he was at Sida and he's now with the Global Transfer. I think he's back at Sida, okay. But I think his doctoral thesis was really looking at the effects on fertility from social pensions, and he found a decrease in fertility in some African countries.
Yeah.
Decrease, yes, which is logical if you see having children also as a part of your social protection.
Yeah.
So is that right? If I remember right, I think. Yeah. Yeah.
And there are more studies on it. So it's like, yes, and there are a number of studies that had looked at it and the transfer products. So that's quite clear that in general it doesn't increase fertility.
And the other approaches around either delaying age of marriage or also delaying first pregnancy, so both in Mexico and some in sub-Saharan Africa, where there's been a payment that is made at the end, if a girl reaches the age of 18 and hasn't had a child or doesn't get married yet, those have also been shown to work and delay fertility. So, and the belief, therefore, is that it contributes to overall lower fertility. So, yeah, I think I was going to say the same thing, but I imagined you all knew that data better than I did.
So that was a clear answer. Sarah, please.
Hi, Sarah Thompson. I'm on the Africa department at Sida. My question is a bit philosophical for you, and but actually I think has important for us to think about. It has to do with the risks of when we do social engineering without the basic gender norms have being changed. And what we're seeing in Zambia right now, for example, in the effort to achieve gender transformation, which is all of our goals, obviously, there is an eagerness, and they've been putting in penalties to women who come for their prenatal care without their husband, or a cost for family planning services if they come without their, obviously this is not human rights based, and obviously it's going to only make things worse for the already vulnerable women who, for example, are perhaps sneaking to get family planning services, et cetera, et cetera. So obviously, that's not something we want to encourage, but something I've been grappling for a long time, as we're encouraging men to move into the spheres of and the space of women's reproductive health, isn't there a risk also that we're increasing the likelihood that men will believe and to also affirm the already present belief that men are the ones who make decisions over women's bodies? So again, we're totally on board with gender transformation. I've always believed in, male engagement and specifically in men's health. But in these programs that you're implementing now, how do you avoid that tipping over?
Yeah, much more than a philosophical one. It's a real rights and harm issue. So yeah, I think whatever tweaks or changes to, whether it's the protocol for a prenatal visit or a family planning visit or a cash transfer program, I think we have to go in with a do no harm approach. And I think and there's both the danger and the promise of programs that reach so many. So if if an edict comes in, we've seen this in more than Zambia, so there's also reports of cases in Uganda and Rwanda where when the order comes from on high saying we want to get men into prenatal visits, it can quickly turn into an incentive that says, where's your partner? Instead of a screening protocol that says, we ask her, is there violence happening in the relationship? Do you want him there? If she wants him there, we figure out ways that we try to invite him. We've tried to do some work on that in HIV/AIDS for a long time. So I think it's, can we get the protocol right and make sure that the gender transformative part of it is there? It's not the issue necessarily that he's there as the end goal. The end goal is the gender transformation. So I think that's where one of our points was the importance of the gendered attitudes of staff. Do the staff who are implementing this, do they get their role as protectors in that process, and making sure that the visit and whether the male is present or comes along is not the man's right, but it's her right to have him there if she wants him there. And that holds up for childbirth and, both access to family planning visits as well as prenatal as well as to childbirth. So I think, I have to believe that at least we can get those protocols better and keep that rights focused while also saying we need to find ways that we nudge men to be involved, but not all involvement is necessarily positive unless we work to try to ensure that it is. So I see that as, that's a design flaw if we don't do it well. But I do think going in with a do no harm approach, not to say at all costs we must get men in the door on this. That's easy to say standing here. If you're coordinating a national program that reaches so many places and so many staff that you don't have the possibility to see them face to face, becomes a real challenge. And that's where I think good training, better protocols, kind of follow-up from ministries to hold accountable. We've done a little bit of work like that with Rwanda, and it's can be touchy because the person in the headquarter office may not want it known that the rollout didn't go as well as was being reported. So more than philosophical, it's a really important design question, rights and design question. Yeah. Yeah. I mean, I suppose the other side of that question is many men already think that. So, at the very least, I think our current status quo is not equal. So it is trying to figure out what is a pathway to equality? What does it take, to nudge men toward that? Maybe I'd turn it around and say, I think when men feel the cost, whether it's time use and are responsible is a vague word, but as men do more of the hands-on care work, we tend to see them be more involved in reproductive health in positive ways. So maybe one of our questions should be, we shouldn't do our reproductive health campaigns targeting men without thinking about care work and care burden more broadly. So I think I'm agreeing with you that the norm change has to come along with the policy change.
Thank you so much. We'll continue, and there will be time for more questions, but I'd like to invite the panel, and Gary, if you would like to take a stand at one of the tables, and also Ulrika, if you want to join us. And also with that, I want to welcome our two additional panelists. You've already shortly been introduced, but just to know, for you to know who you have in front of you, Gunnel Axelsson Nycander from Swedish Church and Church of Sweden. You've been working with a lot, when I read up, with a lot of different fields, for everything from agriculture, trade, climate change, and business, and now you've also kickstarted Church of Sweden's social protection work, I read, in 2012. And one of the things that the Church of Sweden has done is published a publication, Cash in Hand, an anthology on rights-based social protection. So, at least from my perspective, looking at Swedish civil society, the Church of Sweden is really one in the front lines of talking about social protection. So, we're really glad that you were able to join us here. And as I said, we're also very glad to welcome you, Joya, Serajuddin Joya, who is a human rights and gender manager at the Swedish Committee for Afghanistan, and you also have a very broad development sector experience, working with rural development and gender mainstreaming and rights-based approaches. And I listened to you recently this Monday when you presented the experiences of working with masculinity and male engagement in Afghanistan. So, and it's really interesting to hear the challenges, but also your positive experiences of being able to challenge those social norms. So very glad that we have both of you also adding to the conversation here. I'd actually like to start with you, Joya, based on what you've heard this morning, but you've also been, I've seen your name in different panels throughout these days. What are your main reflection when we talk about masculinity and male engagement in a Swedish development cooperation context, and particularly if you have on social protection?
Well, thank you very much, and good morning, everyone. I think there were some presentations which reflected the key points of how it is important to take into consideration the masculinities and men and boys engagement into the social protection. So, the first thing first is, I think that, the social protection system and policies will not work very effectively unless gender sensitivity is not an integral part of the system. So you need to think about certain specific strategies in order to make sure that the programs and protection services addressing the social traditionally norms at that grassroots level. Then only you may have the results in terms of achieving gender equality and equal service, equal access to all the target groups and right holders and duty bearers. So that's very important first things. And the other thing is that, you know, the social protection services, it's very important that it has a key focus on decision making of the women at that grassroots level, especially when it comes to you know, in different contexts. You know, women are engaged into the income generation, so they earn income, but the key issue is that they are not, you know, they have no, you know, like kind of control or decision making or ownership on that income that they are earning. So that makes them even more vulnerable. They earn money, but they have no control over, you know, those resources and money. And the other very important thing is that, you know, contextual, cultural, and conflict sensitivity. So there are three key, you know, elements and aspects which can, you know, be a kind of a key part of the social protection system in order to make sure that all those cultural sensitivity is taken into consideration, and they are not, you know, stopping us, so that to provide equal access to the services for women and men, boys and girls at that level. At the same time, do no harm in conflict sensitivity. I think, you know, these are the very key elements. In addition to that, we need to have a very comprehensive result-based and gender-sensitive monitoring system. So in order to make sure that the social service programs, in order to measure the impact of the social service program on the life of women and boys, men and girls at that level. And also to you know, think about, you know, future programming in order to make them more gender sensitive and gender responsive.
And maybe just for the audience, if you could just very shortly share what you do with social programs on men and masculinity in Afghanistan.
Actually, Swedish Committee for Afghanistan, we are implementing, you know, in Afghanistan 4 key, you know, programs. We are almost more than 36 years in Afghanistan. And one of the programs which is contributing actually to the social, you know, protection. One is the education programs. The other we have health and you know, this maternal health programs, and then we have disability empowerment programs, and the other rural development, livelihood, and governance program. So these are our programs that directly contributing into that social protection system. In addition to that, we have gender and gender mainstreaming as a cross-cutting you know, theme for all these programs. And to this gender mainstreaming program, we are implementing men and boys engagement. So the key focus of our men and boys engagement is to address all those social traditional norms through active engagement of men and boys into the process. Afghanistan, you know, is still a context, a men-dominant context. So men are, you know, the ultimate decision maker at various levels, starting from household level to social and even national level. So unless you do not involve them into the, you know, process, so the change will not be happening effectively. So that's why, you know, we are working with groups of men, especially with the faith-based or with the religious scholars as a groups of change. And then we also work with the young boys, school students, you know, to enhance their awareness, to enhance their knowledge in terms of all those impact of, you know, social norms, traditionally discrimination, harmful gender practices, so that to engage them as a support into the process.
Thank you. Have you lived in Afghanistan, Carrie? Is one of the 40 countries where? No. Okay.
We did carry out images in Afghanistan, and you know, I think a lot of the points that you brought up can be affirmed in terms of men's decision making, men's control over women's movement. Not a lot of, in many countries we see that younger men tend to be more supportive of gender equality. We didn't find that in Afghanistan. There were some young men with education, so particularly university level, showing more progressive views, but and the impact, of course, of the years of conflict and what that has meant in shifting ideas about masculinities and the huge rates of trauma there that have to also, I think, be thought about.
Okay. Yeah, of course. Gunnel, I have to ask also, when you've read the report and heard this presentation, with your experience from social protection, any new thoughts that came up, and what were your main reflections? Mm-hmm. Or?
It's on? No. Yeah. Yeah. Well, thank you very much, Iba and Promundo, for a very interesting report. I think extremely interesting, that makes the case that personally and ACT Church of Sweden has, for many years been convinced that social protection is an extremely important tool. But I think you show very clearly that there's a huge untapped potential for integration of gender aspects, and specifically involving men, and also making the case that all men don't behave the same way. I think as faith organization we can identify with all faith actors don't act the same way. We know that a lot of faith actors are not very proactive in terms of gender justice, but we are, and we know the importance of finding those different actors. And there are two specific takeaways for myself, which I found very encouraging. And the first one is that you cannot say actually that women spend money more wisely than men, which I think is an assumption many of us have had, and it's always been repeated once again. And we know the Swedish child grant until quite recently was given to women. And I think there are good reasons, maybe not because they spend more money, but because it has to do with empowerment. So there's still good arguments for it, but I think that's very encouraging. Another thing is that overall, you both at Sida and in your study, you show that the overall tendency is to decrease gender-based violence, because I've heard anecdotal examples of the opposite, which of course is very, very scary. So I think that is very good. I would have, you have excluded all the pensions for certain reasons. I really would have liked to see that also, because I think, as you saw in the number of programs, pensions are a big portion of the programs, and the situation of elderly, especially elderly women, is very important to support. So I think that would be interesting to see as well. And then I have a question which I think links to what Sarah, your point there, and you're making in the study a sort of clear division between gender accommodating and gender transformative, as if they are different strategies, and accommodating sort of leading in a wrong direction, if you interpret it in a hard way, which I would like to question whether you could instead see it as step, what the accommodating maybe as a step towards longer, more transformative change. You were mentioning nudging, which from the climate change discourse and discussion is now coming a very important concept in terms of perhaps it's difficult to change norms, but if you start to change behavior, norm change will come after. I think psychologists talk about cognitive dissonance or something. So I think the behavior and the norms have to, it's not always the norms first. And I think Sarah also mentioned the word social engineering, which has a lot connotations to it in the Swedish context, and it's not always very positive. And I think if we aimed for very transformative changes, we have to know that this is political. There has to be some degree of acceptance. Maybe not a majority, but there has to be some degree of acceptance. And I found two, in one example on page 38, referring to Bolsa Familia, it was mentioned as a problem that women agree that they, as caregivers, should receive the money. And then your conclusion is then we should change norms also among women. In another example, talking about a program in Nepal, you referred to women being influenced by program workers so that their choice of how to spend the money was not their individual choice. But then that was a problem. The influence was a problem, and it was paternalistic. So I think the issue of how to change norms, and I'm sure you're aware of that, has to be, it's not clear-cut, and you have to be very
fingerfärdig. That's
I'm stuck there. Thank you.
Thank you. Gary, do you want to respond to that already now? Thinking there were questions about, and maybe also define, because in the report you do go into depth about these definitions of gender accommodative compared to transformative. If you want to just, in 30 seconds, explain the difference.
So there's been, over the years, Gita Rao Gupta came up with some of these terms for thinking about whether they're gender blind, gender neutral, gender accommodating, gender transformative, whether a program, lives with the social norms in a given setting and says we see them as what they are, we don't, do much to try to change them, or whether it simply ignores them and designs a particular benefit without looking at them, or whether it tries to change them. That's the transformative category. Mm-hmm. And I think your point is right. These are, often those look better on a slide in terms of categorizing a program than necessarily get the complexity of a program that may be transformative on one element, mm-hmm. but sort of gender blind on another one. So yeah, it's more differences of quality than somehow these are mutually exclusive categories. So yeah, I think that's a good point. We should be careful that categorization doesn't get in the way of good enough programming, let's say. So yeah, a good point. And I think your point on, which way do we achieve change? Is it the norms or is it the behavior change that we achieve first or the norm change? Do we pass, and this is a bit Sarah's question as well, do you pass laws that are ahead of norms? Mm. Again, this region offers some interesting ideas of nudges around men's take-up of paternity leave and offering use it or lose it days in Norway and Iceland, finding that they work. They probably were even ahead of where public opinion was on that. But government saying this is worth it in the name of gender equality, we're going to experiment with trying to do it. Whether some of these programs should be nudge in the sense of we're going to assume that you want to be in this program, not ask you to come sign up. Here's a program that we've worked with the Brazilian government on around prenatal visits for men is a protocol that says if he comes, you don't ask him if he wants to come for a follow-up visit. The nurse comes and offers him, I've got these 3 times for you to come next week. So instead of would you like to come, I'm assuming you want to. And just how subtle things like that can shift, whether a man says, well, no, I don't really need to come, or if the nurse is looking at him saying, you're coming, which of the 3 times do you want to come? That could be coercive in social engineering, or it could be really good public health. Mm. In this case, I think the public health benefit weighs out. So I think, these are subtleties that I think we're getting better in policies, but a lot of the really best potential of these programs is in those subtle decision-making moments. And I think that's where there's some potential on the programs. Maybe we'll come back to the pension question. I'll stop there.
Joya, later I want to hear a little bit on your thoughts about this, sort of on that nudging, but Ulrika, before we come in, or I'll let you in first. I'm wondering from a Sida perspective and hearing the findings of this report, is there anything that you see that perhaps could be changed currently from how the programs work on social protection to become more transformative, if that's the goal?
I think, thank you. It was an interesting presentation, an interesting study. I think one issue that really struck me when I saw your presentation is comparison of time use between women and men. Yeah. And when I looked at the combined time use and the differences between women and men in Africa and the differences between women and men in Europe, they were very similar. So, that was really astonishing that we in Europe are not doing better than in Africa in terms of time use and the burden on women and men, how much time we spend on care work. In in social protection, in our support to social protection from Sida, I think gender equality is a really important aspect, and is really important to see how can we make sure that we have the strongest possible impact for improving gender equality. But I think it's very important to involve men and women in dialogue. But the question is then, how do we do it and around which topics? I think we need to be very context specific. In Burkina Faso, I think that time use is probably also a very strong issue, but I still think we will continue to prioritize good parenting, that children go to school, girls get to go to school, that the girls are not trying to affect that fewer girls are married off before they're 18 or before they're 15 years. We see this as key issues together with nutrition. So I think we will need to consider because since we're trying to build, I think this type of projects can also contribute a lot to learning about gender roles and gender dynamics within the household. And that is something we actually want to support more research on the gender dynamics within the household, which is something we have dialogue with the Transfer Project about, because it's an important aspect. But at the same time, how do we build the large-scale systems that governments can really reach out to millions of people? How do we work with this? I think the work that Ethiopia is doing and starting to do with training social workers and having barefoot social workers at the community level, that could be an entry point. But that is sort of groundbreaking. We don't have that in other countries, but that could be a future. But I wonder if you have looked at, in terms of gender roles and social protection, on other aspects. You look a bit at decision making and these other aspects, but it's a wide. It would be interesting to hear your views on how do we prioritize among all these issues that are important for gender equality.
Keep that thought and think about it a little bit, Gary, because I also wanted to come back to the question to you, Joya, on a little bit on the how, on how you work with masculinity and norms. And there was this issue came up about social engineering, but also compared to institutional change, the need to work with policy at the same time. But if you look at social norms in particular, what are the key questions that you ask, or statements, if you don't ask, that you talk about within your groups that you meet?
Thank you. That this first of all, this working on changing the norms and behavior is a long-term and a very gradual process. So it is always not easy, and it is also not easy to measure in a short term the impact and the result that is creating. But when it comes to the laws and then social norms and then institutional building and all those things, it differs from context to context. For instance, if I give an example of Afghanistan, to sometimes even these social norms have more dominant on the behavior, on the practices, on the exercises that is ongoing within the community, particularly when it comes to human rights and gender or gender equality. So there is more influence from social norms and traditional practices than laws. So that's why you sometimes the source for all those perceptions and behavior and practice is considered the social contracts and all those norms that has been set at that level. So they are somehow even the law is influenced from that perspective and that behavior and set norms that's there. So the people who are then setting these norms and setting this practice, who are, ruling these all those social traditional norms, are first the religious scholars that are as a gatekeepers at that level. So that's why the engagement of these religious scholars as a organizations or as an individual is very important, so that to first have the support in order to make sure that all those traditionally discriminatory norms and gender norms and values and social traditional norms are, you can influence them. When you have the support from the religious scholars as an institute or as an individual, then, the rule of law can also be facilitated at various levels. So that's, our understanding. And we work with these religious scholars at that level, and we work with the men at that level in order to engage them as a partner, so that to first, could influence those traditional norms at that level, that, that limits the opportunity, limits the access to rights, particularly for women and girls. So then only we can have a progress on gender equality.
Thanks. Gary, do you want to quickly answer the questions on if you looked at gender dynamics?
I mean, your question on what to prioritize. I mean, I think, your point that education for women and girls is a key driver of change, and we know that from around the world. But we also know that often the hugest impediment to girls and women achieving the level of education they want and participating in paid work and participating in leadership at the community level or higher is the time use issue. And so I still think if you have to find where is the core of patriarchal power, men's control of time and who gets to be where is really such a key part of it. And so I do think if you have to choose, that would be, I think, when you start to see men doing more hands-on care work, it does begin to unravel lots of other things in terms of men's beliefs that they get to control where a female partner gets to be, and changing their own priorities of how they view what matters in the family arrangement they live in. So I still think that feels to me like one of the power cores of patriarchy, that if we can chip away at that one, it does change kind of lots of other ripple effects. I think the other one, the importance of the impact on gender-based violence of such programming. But again, I think the changing of household power by having men do more care work is also a damper or a conserve to reduce some forms of violence at the household level. So I guess if you made me choose, a policymaker, which way should we try to nudge some change around here, I would still push on the time use issue. It seems to be so key to so many other elements.
So time, as always, is running by, but I want to allow, I promised you the time to also for the audience to ask more questions to anyone in the panel. Please raise your hand if you have anything further. You have one there in the back.
Hello, I'm Maria Bergqvist. I'm from IOGT and to Movement. Well, I think I would like to ask you if you have noticed a lot of positive aspects of these funds, and also some of the negative, as you say, domestic violence, for example. I would like to add and ask you if you have noticed or seen more negative aspects of unconditional funds, particularly, because in our work we have seen not this kind of funds, but micro credits or income generating for women, that actually they've not been successful because the women have experienced that when their income increase, the man actually use the money for going to the bar, spending the time there, and then also you've seen an increase in domestic violence, for example. And that is not, as you say as well, it's not all men, we need to say that, but it's very tied to norms. But we also see that in Sweden, for example, when the barnbidrag comes, there's a higher degree of drunk people or violence, coming to the wards, for example, like the hospitals wards. So both, if you've seen any negative aspects of these, and also I'd like to highlight, as you say, the need to look at the policy sides as well, connected to negative norms or negative masculinity, for example, like alcohol regulations, for example, to support the women, and also not just as a flaw in a design, but actually as a real proper do no harm analysis before we start dropping money to families which could actually harm the situation.
Let's gather a few, if that's okay. If we have any more, there's one more here. You are allowed to ask 2 questions.
Thanks. Hi again. So I'm Louise again. So I was thinking about this women, the unpaid work that they do, and the rollout of these contributory social insurances that kind of depends on the labor earnings of women. So I guess that's also a problem for gender inequality. And is there any approaches to kind of include the gender aspect in these social insurances? Yeah. Thanks.
One more here, and then let's go back to the panel.
So my name is Milena. I have quite a lot of experience working in sub-Saharan Africa with changing gender norms, both on the research level, on the facilitator level, and on the program design level. And based on that, I have a question, particularly to Gary, I think. One of the things that I find most difficult to deal with, or that concerns me most, is that when you encounter resistance on the parts of men, that's to be expected, but when you encounter resistance on part of women, I'm going to give a particular example in relation to time management, because you insist a lot on that, and I believe also how important it is. So many women I have encountered and discussed about this say time is not a problem. This is my experience with women in sub-Saharan Africa. They say, it's up to us. This is our role as women. This is my pride and joy to cook for my husband. I'm prepared to spend the time it takes. I'd rather go to bed late, get up early. And the advice, particularly it's older, middle-aged women who say this, and they always give the advice to younger women who try to resist. And I know this is classic, of course, that many customs are propagated by women. I know this. But I'm taking this particular example and saying that I often then say to the young women, it's up to you, just be organized. Just be organized and everything will be fine. So this is nothing new, but I'm just curious, since you work so much with this, Gary, do you have any particular advice on how to deal with that, except for time and sensitizing and giving the facts and so on? Do you have any particular advice?
Okay, so I think a lot of questions directed to you directly, Gary, but I think let's see if you also have the others in the panel want to respond as well. But more on experiences of negative aspects of, particularly if I understood, unconditional funds, unpaid work and linkages, social insurance, and then resistance of women. Do you want to start, Gary, and see if other ones to jump in?
Let others comment.
I think I know, but I'm sure that others will.
Yeah, I think on the gender-based violence issue, every context is a context, and I think we do have to, some income generation programs targeted women, whether microcredit or other kinds, have shown that. In other parts of the world, they haven't shown that. So I do think the issue is that we're attuned to it, and increasingly say, if we've got a field of practice of things that seem to reduce men's use of violence, why aren't we doing more deliberate packaging of those? So if we know this is a risk, what are things that we could do that we build on what we know about some good GBV prevention work out there, which exists? And I think there's a few examples of when we package those things well, we reduce the possibility of that harmful impact. The challenge is, of course, that costs more funds. So how do you build that into the cost of programming if you're going to roll out a VSLA program to reach 1 million households in a given country in sub-Saharan Africa? But I think that the results tell us that if you don't, that is one of the issues that can happen in the short run. So I think we've got to figure out how we balance that risk, but also think about, yes, we need to add this as programming. You should think about if you're going to roll out this income generation program for women, an unconditional income generation approach, you probably need to think about some activities that you do with men to try to reduce the chance that that happens. Both that you've got protective services in place and that you're thinking about the kinds of GBV prevention you need to do.
Let's see if Ulrika has something
yeah.
on this particular topic that you want to add.
Yes, I can just add that it's very context specific what results you get. But in general, I mean, intimate partner violence is decreased. And in general, it has not been seen that actually money goes to spend on alcohol. But we do see in Africa that conditional cash transfers have the negative side effect of increasing actually the time burden for women, and also of increasing the administrative cost and the risk of administrative errors, etc. So, I mean, unconditional cash transfer is our preferred modality, but then we also need to be context specific. So.
And then back to, or Gunnel, did you wave your hand? No? On the other, on unpaid work? Back to that.
I have less to say on the social insurance question.
Okay.
I was going to look to Ulrika.
But you have, Gunnel, please go ahead.
Comment on that. I feel less informed on that one.
Well, I thank you very much for that question, because actually I have been feeling quite a little bit uneasy with the very narrow focus on social assistance that we have here. And also from a Swedish perspective, we don't make the difference between insurance and assistance, that we say it as a whole system. And I think, especially when it comes to changing gender norms, at least if the social assistance are very narrow, you will not reach a large portion of the population. And then going back to the Swedish experience, for instance, I would say that, yes, we had the daycare center, that was important, and the paternity leave, but I think maybe the most important incentive to actually get women out on the labor market was the tax reform in 72, I think, when we went from income tax on a household to individual, which is a very strong incentive for the second income earner. So I think, yes, we have to look at it broader. And if I may...
Yes, you may.
Last minute comment, I would also say that we have been talking about conditional and unconditional, and I agree really with what you say, that perhaps sometimes for political reasons we may need them, but they're not really useful. But I would also just briefly raise the issue of coverage and targeting, whether we have poverty targeted with small coverage, or if we have a universal approach, which is the main issue that Church of Sweden and ACT Church of Sweden is concerned with, and where we have for a long time, based on the Scandinavian experience and with many different arguments, been saying that try to go more for the universal approach rather than the very poverty targeted, which mainly the World Bank has been promoting. And I would just like to announce that we will soon be presenting here in Stockholm a report that we have made together with Development Pathways, which have shown quite stunning figures on the exclusion rate with poverty targeting, which really calls into question the issue of whether you can have social assistance with small coverage to reach the leave no one behind goal. Thanks.
Thank you.
And I do have a few copies of that and some other reports if you want to.
Good. Well done. Gary, I'd like you to give you at least the final words. Time is running out, and it's really running out. So your main advice to in this aspect donors in this context, Sida and the Foreign Ministry, perhaps, what would that be from everything that we've heard today?
I mean, I think Ulrika and Lisa, your presentations as well affirm what we know is that these work. So let's make sure that we're not messing with the aspects of them that work well. I think it's a matter of doing some interesting experiments that say if we deliberately and proactively try to engage men in positive ways, there's enough evidence that says we should test some kind of scaling up of this. So I think maybe the locus of some action on this could be with the multilateral banks in a couple of countries where they seem to be, because often they've funded a lot of the research that's gone into this and a lot of the innovation in them. So maybe a couple of countries where the cash transfer programs are working well, they're solid enough, administratively they're holding together, there's enough technical capacity that you could test an approach, you could make sure it's not causing any harm along the way. So yeah, if there were ways to test in 2, 3, 4 countries, adding on a benefit of engaging men in proactive ways would be, I think, could go a long way. If you gave me just one thing to choose.
I only give you one, but thank you for that. And I'm sorry for keeping you more than 5 minutes behind time. If you do want to come to the next EBA seminar, that will be on the 6th of November between 2 and 4, and then we'll be talking about fishing aid. If you want to know what that is, go to the website. Thank you so much. Tack snälla. Det blir